My name is Mariana Garcia, and I'm a postdoctoral research fellow at the Division of Cardiovascular Diseases at Mayo Clinic. I am here to talk to you about our review article entitled Focus Cardiovascular Care for Women, the Needed Role in Clinical Practice, that will appear in February's issue of Mayo Clinic Proceedings. The concept of focused cardiovascular care for women is rather new and mainly emerged due to the recognition of sex-based disparities in the treatment of and survival from heart disease. Our review article provides clinical updates regarding focused cardiovascular care, as well as encouraging the establishment of focus centers, often termed women's heart centers. Women's heart centers are multidisciplinary settings staffed by expert providers who are familiar with sex-specific cardiovascular issues, potentially resulting in better outcomes for women at risk or living with cardiovascular disease. The first takeaway message is that optimizing women's heart health involves the recognition of sex and gender-based differences. Our review article focuses on sex-based factors that contribute to differences in the prevalence, morbidity, mortality, and treatment of cardiovascular disease, as well as the identification of newly emerging risk factors unique to or more commonly seen in women. The second takeaway message is that women's heart centers can address cardiovascular conditions or risks that exclusively or disproportionately affect women. Those that exclusively affect women include pregnancy-related adverse cardiovascular outcomes, postpartum cardiomyopathy, hormonal and metabolic disorders such as polycystic ovary syndrome, and menopause or menopausal hormone therapy concerns. Those that disproportionately affect women include coronary microvascular dysfunction, spontaneous coronary artery dissection, apical ballooning syndrome, inflammatory conditions associated with autoimmune disorders, peripheral arterial disease, heart failure with preserved ejection fraction, and postural orthostatic tachycardia syndrome. All of these conditions are reviewed in our manuscript. An impressive public awareness effort continues with the Go Red for Women and Heart Truth campaigns, which have raised awareness of cardiovascular disease as a leading cause of death in women. However, knowledge gaps in clinical practice approaches to recognize and mitigate cardiovascular disease in women continues. Thus, our review serves an important role to focus uniquely on cardiovascular care for women and summarize strategies for prevention, diagnosis, and treatment. Although heart disease has killed more women than men since 1984, until recently, women's heart disease treatments have been based on medical research performed primarily on men. Focused cardiovascular care for women can help correct these disparities through recognition, education, and empowerment of the female patient.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.